Bismillahirrahmanirrahim. Salient features of circadian rhythm are discussed in this video. The diurnal variation or fluctuation in the secretion of glucocorticoid secretion is termed as circadian rhythm, and this secretion pattern fluctuates in 24-hour cycle. It is regulated by hypothalamic pituitary adrenal axis and closely aligned with the sleep-wake cycle. The key features of this circadian rhythm is that the cortisol level are highest in the early morning, typically peaking around 6 to 8 a.m. in the morning and approximately 1 hour after the waking. The plasma cortisol concentration can reach up to 20 microgram per deciliter during this peak time. This surge helps prepare the body for daily activities by mobilizing energy substrate, increasing blood glucose, and enhancing the alertness. And then there is decline throughout the day. After the peak in the morning, these cortisol level gradually decline throughout the day, and by late evening and midnight, cortisol level drop to 5 microgram per deciliter or lower, reaching their minimum. There is oscillation in this circadian rhythm. This circadian secretion occurs in pulsatile bursts with a smaller oscillation throughout the day that are superimposed on the larger circadian cycle. Then this secretion is under the hypothalamic control. The rhythm is driven by a 24 hours daily cycle of corticotropin releasing factor secretion from the hypothalamus, which stimulate adrenocorticotropic hormone release from the anterior pituitary, subsequently leading to cortisol secretion by the adrenal cortex. And it also influences the influenced by the sleep and wake cycle. So there is a strong influence by the sleep pattern. If the person shifts their sleep-wake schedule, for example, due to night shift or jet lag, the cortisol rhythm gradually adjusts over several days. So if there is stress, psychological or physical can override the circadian rhythm, causing rapid increase in adrenocorticotropic hormone and cortisol secretion at any time of the day. So the clinical significance of this is that the cortisol measurement are meaningful only when the time of day is noted, as levels vary throughout the day. Abnormal cortisol rhythm, that is flattened rhythm, can indicate disorders like Cushing syndrome, Addison's disease, or chronic stress. The timing of glucocorticoid medication such as prednisone often mimics this natural rhythm to reduce side effects and improve their effectiveness. This graph is showing the typical daily pattern of circadian rhythm of the cortisol concentration in the blood over a 24-hour period. On the x-axis, there is this is marked with the time from 12 a.m. to 12 p.m. 24 hours graph, including noon, a.m. and p.m. On the y-axis, there is cortisol concentration that is shown in microgram per 100 ml. So there is a morning surge. Cortisol level rises rapidly in the early morning hours, peaking around 6 to 8 a.m. This peak concentration is around 20 microgram per 100 ml, typically 1 hour after waking. Then there is daytime decline. After reaching the peak, the cortisol level gradually decline throughout the day. By the afternoon and evening, cortisol level are reduced to around 5 microgram per 100 ml or may go lower. There is lowest concentration of this cortisol overnight, that is termed as nocturnal low. So in night, especially around midnight before starting to rise again before the dawn. So these oscillations are smaller oscillation. These oscillations are smaller oscillations in the cortisol secretion throughout the day, indicating the pulsatile release. And the early morning peak prepares the body for the day, enhancing alertness and energy. The decline in the evening and night aligns with the body's preparation for sleep. This pattern is controlled by hypothalamic pituitary adrenal axis and influenced by sleep-wake cycle, as we have discussed earlier. Thank you for watching this video. If you have any query, please write in the comment box.